Today, I want to talk to you about how to naturally lower your bad cholesterol and why measuring your LDL is just not enough. Hi, I'm Dr. Angela Jaeggli. Welcome to Sage Health TV. I'm very passionate about this cholesterol topic because I feel like a lot of people don't know that really what they're getting at their standard doctor's office is really just not in depth enough to really make some good decisions about your cholesterol and your health long term. Cholesterol, most people think of it just because of some old studies actually that were not very well done, that cholesterol is bad, and that is not true. Like, we have to have cholesterol to make our hormones. We have to have it for our brain. We have to have it, our cells, essentially, the cell walls are made of cholesterol. And of course, we want this to be really healthy forms of cholesterol, but, we really don't need excessively low, cholesterol levels. And there are a lot of studies that actually have bore that out over time. So before I get into this here, I just want to talk about, like I said, LDL became kind of vilified through a study that was done back in the 50s that actually wasn't done very well. And then all of the recommendations kind of were based on that and continued forward actually until current day, even though now there have been hundreds of studies and even studies that have looked at people who have gone into hospitals. Actually, there was a study looking at 454 different hospitals who submitted data of people who had heart attacks, and over 70% of them did not have high cholesterol, actually, and 17% of them actually had lower than 70. So the recommendation these days is to have your LDL 100 or lower, and so 70 is pretty low. And so there are a group of those people that had heart attacks that actually had, that low of cholesterol. And so when you look at the studies, like, well, who did, what did they have? Obviously, they had something if they're having heart attacks. And really what they had was blood sugar dysregulation and inflammation and obesity. So that looks like a prediabetes or diabetes, or what we call metabolic syndrome, where your insulin is really high and your blood sugar is imbalanced and you're overweight, usually carrying weight like in your abdominal area. So really that was in all of them, they all had something in that category. So when I am measuring cholesterol, we want to incorporate all of that. And I've got some some nice things to show you today. So when we're measuring, let's talk a little bit about, I think I kind of got this a little backwards, but so when we talk about bad cholesterol, or again, maybe I shouldn't call it bad cholesterol, LDL, really, I'm going to explain when we're talking about what makes it bad, right? So when we're talking about cholesterol, it's actually made of a bunch of different sizes. So I don't know if you can see here, but there's a whole bunch of different particle sizes. And so the smallest, the little tiny ones here, are the most inflammatory, the most, more likely to cause damage. So they have an easier time actually getting into the lining of the artery and starting to build up plaque. And so what we really want when we're looking at cholesterol is we want to shift these particles to this larger size. And that's the same case with your good cholesterol. So good cholesterol is amazing. Good cholesterol actually is what we call a reverse transport molecule, meaning it actually goes into the lining here and picks it up and takes it away to be processed in the liver and broken down. So that's why everybody's like, more good cholesterol, more fish oil, things like that. So we want to measure these. So what this is called is a lipoprotein fractionation panel of your small and medium particles, which really they're going to include, all of these, but these are the most important. So I'll have somebody who actually their cholesterol looks really good. You're like, hey, you're doing pretty well. We do this. All of them are inflammatory. You're like, oh my gosh, wow, if we wouldn't have treated unless we had seen that. We also have the opposite, where you're like borderline high and you're like, oh, you've got maybe a little too much. Like maybe you're running at 130 or 140 or 150. And all of it is like this beautiful, nice, juicy, big particle right here that's really not causing any problems. And your other markers are looking really good too. So you don't always need to treat it when it's higher. We just need more information. So what we also want to look at is something called hsCRP, which is an inflammatory marker. That's one of our initiators here, meaning it drives inflammation. Oxidative LDL, which is like a free radical or a damaging version of LDL. As you can see, it's one of our beginning like initiators. This is like a newborn baby right here, like nice clean artery. And so we really want this to be low. This is plaque stability, MPO and LPPLA2. So we can actually tell. So everybody has a little bit of plaque, especially as we get older. So really even can be even in the 20s if your diet and you're very overweight. So it'll tell you how stable your plaque is. And then ApoA1 is the carrier of the good cholesterol. And so the higher that is, the better. ApoB is the opposite. It is how much or how quickly are you driving your cholesterol into this lining of the artery. So if that's high, obviously we want to get that down. Fibrinogen is a clotting marker. So if that, in most people, that tends to be high. And so we work on it through, there's a particular enzyme that breaks it down. And then we do other diet changes. So okay, so you've done all of these and say things have come back positive and you're like, okay, you have a lot of small particles and your inflammatory markers are high. So what we start working on, of course, diet is going to be the first intervention. And really, and the studies show this too, that if we just shift towards whole foods, I mean, even just doing that simple process it's going to start making a difference. And so what that means is like a diet like Whole30 or even like a paleo regimen type regimen. Not really going to talk much about keto because keto can be done poorly because it's highly fat-based. So if you're not really doing the right fats, it can actually be hard on you and your cholesterol. But it can be good. So that's a whole other topic, keto. And then so really the focus is actually getting that sugar down and getting your processed carbs down. So that's the important part of the diet is taking away processed food and then getting your sugars down significantly. And then we want to increase your good. So we want to think more omega-3s. So in food, that's like cold water fish, although we have to be careful these days just because they are full of heavy metals. So I usually don't recommend people eat a ton of fish, but doing fish oil that's been filtered is great. And then walnuts, pecans, flax actually can really drive omega-3s in your diet. And then if we have to use some treatments, I really do like niacin, and they do have a flush-free niacin, but that can be good. And we're looking at somewhere between 500 to 1,000 milligrams a day. And then red yeast rice extract is also really, really good. I forgot to put something on here, but red yeast rice will pull your CoQ10 just like statins do. So statins are one of the main cholesterol treatments, and it will suck all the CoQ10 antioxidant out of your body. So you have to supplement with that if you are on a statin. But we need it too for red yeast rice. And then anti-inflammatories. So this BCQ blend is one of my favorites. It's bromelain, curcumin, and quercetin. Very anti-inflammatory herbs that, again, usually this process here it's inflammation that's driving this. So we need something on board. And, if you're using turmeric in cooking, that's good too. And then exercise, always fantastic, actually. And because the muscles are more metabolically active, so we're burning those sugars, right? There's decreased inflammation with exercise. So a lot of benefits, and it actually will change your particle structure there too. So it'll increase them. So a lot to do. So I would encourage you, these are actually, believe it or not, these aren't like just a specialty naturopathic, only your standard doctor can order them. They might not know that they can because it's not a standard thing that they typically do. But if you're seeing me do this, I would love to do this for you or one of our other doctors at the clinic. Would love to see you. Let's dive in. These are all things that are changeable. And, when we get these down and they look a lot better, your risk long-term for cardiovascular disease and diabetes is going to drop significantly. So thank you so much for joining me. And as always, please like, follow, and subscribe. And I look forward to seeing you next time.